Hello everyone, welcome to our final unit in this class. This time we're talking about autistic, attention deficit, stress, and substance abuse disorders, chapter 17 in your text. So up first we are talking about autism. So autistic disorder is a chronic condition that's characterized by a failure to develop social relations, impaired communicative ability, a lack of imaginative ability, and repetitive stereotyped movements. People with autistic disorder often show cognitive impairments as well. So I think that's all pretty self-explanatory, perhaps except for this, the repetitive stereotype movements. What I mean by that is just sort of things like rocking or making the stereotypes like same sort of movement over and over again, that sort of thing. And to this point, cognitive impairments, there's sort of, I guess, a stereotype from the media that people with autistic disorder are often savants, right? That they might be bad at many things or impaired at many things, but they're really good at one thing. That's not often the case. That's possible, but rare. So how common is this? Well, it's more common in males than in females by a ratio of 4 to 1. More severe forms of autism have a lower ratio, so 2 to 1 male to female, whereas higher functioning end of the spectrum with autism, people who have above average intelligence and reasonable communicative ability, has a much higher ratio, with being 7 to 1 more common in males. This suggests that the social impairment symptoms of the higher functioning autism spectrum disorders are more common in males, but when it comes down to the more severe types of disorders with cognitive and communicative impairments, they're more evenly spread with less of a bias for male than female. Let's talk a little bit about prevalence, especially the increase in prevalence fairly recently in history. So we have seen an increased incidence over the past 2 decades. All evidence points to this being caused primarily by an increase in awareness of the disorder and a broadening of the diagnostic criteria. So with a better understanding of autism and autism spectrum disorders, the criteria for inclusion on that spectrum was broadened, and with very successful campaigns promoting autism awareness, more people are aware of the disorder than ever. So this means more people are being given proper care and are being appropriately diagnosed with the disorder. And I can't believe we're still doing this, but it seems more important than ever to talk about it, with more important vaccines being on the horizon, that research has failed to provide evidence linking autism and immunization. There was that original study, but that was retracted from the publishing journal after the UK General Medical Council found the primary investigator guilty of dishonesty. This has been the pattern, right? All this stuff has been officially debunked, at least in terms of there being no evidence for it, right? So we've known this for a long time. We use careful language in science, right? So we can't say something like, it's proven that there is, this doesn't do it. We can just say something like, there is no evidence to suggest, which means there's no good reason to think that this would cause autism. It doesn't. So people, I think, are thrown off by the cautious language that scientists and medical professionals tend to use. But this is not a thing, right? Vaccines don't cause autism. Get your vaccines. Get your flu vaccine. When the coronavirus vaccine comes through, get that too. It doesn't cause autism. All right, let's talk a bit about diagnosis. So DSM-5, which is a sort of handbook for diagnosing psychological disorders, this is put up by the APA, and it's sort of the handbook that psychologists and psychiatrists use to diagnose and treat patients. We'll talk more about this in a bit. But the official diagnosis requires 3 categories of symptoms: social impairments, deficient communicative abilities, and the presence of stereotyped behaviors. Okay, let's move through each category individually. First up is social impairments. These are generally the first symptoms to emerge. We might see things like infants showing a disinterest in being held, a failure to look at or smile at caregivers, so not really looking in the face or smiling, communicating emotion like we would expect, not seeking comfort when ill or hurt. If you've ever been around children, that should strike you as very unusual. Most children immediately and aggressively seek comfort when they give themselves the smallest bump. So that definitely stands out. Failure to enter social relationships with other children, so they're not making friends and socializing as ordinary children do. And here we have a failure to predict the behaviors and motivations of others. People with autism tend to have problems with what we call theory of mind, sort of imagining what the other person might be thinking or what they might do next. Next up is a disrupted language development. Frequently, people with autism disorders will repeat what others are saying. So they'll just sort of echo whatever is spoken to them, and that may or may not be meaningful why they're repeating it, but they tend to echo what is said. They might refer to themselves in the second or third person. So the language development is disrupted. We also see stereotyped behaviors, including abnormal interests, which could be an intense focus on an activity. So they might be hyper-focused on one interest or a collection of interests. This also includes stereotyped movements, like I mentioned earlier, including things like rocking back and forth or making the same kind of motion over and over again. So possible causes. The generally prevailing theory is that this is caused by biological factors and not some sort of failing of the parents, right? It's not a poor environment or something like that that's contributing to this. It's just sort of genetic, right? Research has shown that parents of autistic children are often sociable and warm and responsive as other parents. And often you see one autistic child with healthy siblings. So this suggests that it's not really an environmental influence. It's not parents being neglectful or in some way negligent, because they often are, warm social folks and they have other healthy children. So, speaking to that genetic influence, estimates of heritability point that this has a genetic root. Twin studies suggest genetic factors. We see concordance rates for monozygotic twins about 70% versus dizygotic twins of about 5%, right? That's very striking, suggesting a very, very strong genetic component. A concordance rate for the more broadly defined autism spectrum disorders is about 90% for monozygotic twins and 10% for dizygotic twins. Again, that's a very, very big split, right? 70 versus 5 and 90 versus 10. This really points to a very strong genetic influence, a very strong biological basis. So there are also cases that are linked to definable biological causes. So, for instance, having rubella during pregnancy is a risk for the child developing autism or autism spectrum disorders. The administration of prenatal thalidomide, which is an immunomodulatory drug, has proven to be a risk factor for developing this. This was also given for sedative effects and to control morning sickness before a link to birth defects was established. Of course, now this is not given, but this is an identified potential cause. Herpes virus encephalitis, so swelling of the brain caused by a viral infection is a contributing factor, as is tuberous sclerosis, which is a genetic condition causing benign tumors to develop in many organs. So there are a number of cases, or a number of biological causes that seem to have a clear link to an increased risk for developing these disorders. So let's talk about some actual differences in brain pathology that we see in autism and autism spectrum disorders. So we see significant developmental abnormalities, including a slightly smaller brain at birth, which will then grow abnormally quickly, resulting in a brain volume about 10% larger by age 2 to 3. But after the initial spurt, growth slows and is only 1 to 2% larger by adolescence. So this is a real difference in the way that the brain develops. The most affected regions show the greatest growth early and the slowest growth late. So, for example, in the frontal cortex, we see growth extremely quickly during the first 2 years, and then little to no growth over the next 4 years. Right? That should sort of come as no surprise with what we know about the frontal cortex and its control over higher order functioning and executive functioning. The fact that its growth is dysregulated makes sense, right? It fits here. So one of the hallmarks of these disorders is a lack of interest or recognition of faces reflected, right? So they're not as interested in attending to faces, and they're bad with faces. And that's actually reflected in the brain. The fusiform face area, which is an area that's important for basically expertise in category learning, like learning about specific exemplars of a sophisticated category. Faces is one of those categories. So this area lights up in healthy controls when you're looking at pictures of human faces. But we see little to no activation in people with autism. So this region is important for the recognition of individual faces, and that's a behavioral deficit we see in autism disorder, and that is reflected in this difference in brain activity. In addition, autistic children show lower levels of oxytocin, which is this peptide that acts as both a hormone and a neuromodulator, which is pretty well known as a facilitator of pair bonding that can help increase trust and closeness. So autistic children seem to have lower levels of this. And administration of oxytocin can improve symptoms, including sociability and emotional recognition. Okay, that's it for our discussion of autism disorders. Next, we're moving on to attentional disorders.